She had dark hair, very beautiful skin. She was just a really beautiful girl.
She liked clothes, she loved makeup.
She was a character for sure. She was
always smiling. I think her smile hid a lot of things that she may be dealing with.
Well, tonight the CDC is sounding the alarm about a record number of deaths in America from drug overdoses.
Preliminary data from the CDC shows from December 2019 to December 2020, overdose deaths rose nearly 30%.
I remember when she first showed me her sonogram pictures, and I go, oh, it looks like a little baby elephant. I told her if it's a boy, we were going to call him Eli, and if it were a girl, we were going to call her Ellie. Her mother was an addict, and her stepfather was an addict, and they were trying to get help. They were trying to get clean. That's when Alyssa came to our home. In my mind, I was like, she's never going to do that. She's seen the horrific outcome of all of that. So it was quite a shock to read her autopsy report.
I saw a picture of like a tiny sprinkle of fentanyl compared to a penny, and that much could kill you.
You know, I've heard of people passing away from it before, them thinking they're doing some other drug and it's laced. But, you know, I never really expected it to hit my family or, you know, come so close like it did.
Here's Alyssa's memory book that when we had her memorial service after she passed away, a lot of her friends just signed these index cards, and we just filled up this book of great memories of her.
In Texas right now, we're seeing some of the highest overdose death rates that we've ever seen before. We're seeing more and more fentanyl contamination across substances. They're not even aware that they are consuming an opiate, a very strong synthetic opiate.
That's my sister, you know? She wasn't just an addict. She was a lot more than that. I just know she was trying to get off of them really bad. Once you treat something like the disease it is, addiction, people can start getting the help they need without, you know, backlash and just feeling like there's something wrong with them. It is a disease, you know? It's not something that someone just decides one day, hey, I'm gonna stop this. Instead of villainizing them, that we could help them.
Do you think we've reached a tipping point where, you know, local and state leaders across Texas can't ignore the crisis that we're in right now?
In Texas, we are cracking down on fentanyl in an unprecedented way. The number of lethal doses that just the DPS has seized is enough to kill every man, woman, and child in the states of Texas and California combined.
We could be implementing robust harm reduction, public health, overdose prevention programs across the state, and instead we're doubling down on law enforcement and, you know, punitive approaches that just simply don't work.
Harm reduction is a way to mitigate risk in the community, and it's also a way to destigmatize drug use and substance use. When you start carrying Narcan, you're technically a first responder now.
Here's some Narcan as well.
What is this?
Narcan is an opioid antagonist.
It comes in spray form. You can carry it around with you. What it does is it boosts the opioid receptors off of your brain and enables people who have overdosed from opioids to breathe. Yeah. So you guys can take this. They're good to have around.
Okay.
You can train your friends on how to use Narcan.
Anyone can carry naloxone or Narcan now without fear of being prosecuted, arrested, hassled for it. And that's what we'd like to see for fentanyl testing strips, for syringes, and all of our harm reduction supplies, which are all life-saving supplies. So we're hopeful that the state will step in line with the federal government and allow not only us, but public health programs across the state to get fentanyl testing strips in everybody's hands.
Traditional wisdom, very conservative thinking has been that, oh, well, you're encouraging opioid use disorder. Well, that ship has sailed. Any movement that goes in the right direction towards more, safer use or less risky use is good. We are not going to arrest our way out of this problem. And any of the politicians that believe that this is some sort of character flaw, that all changes when it's their 14-year-old daughter.
Careful, there are thorns.
I've never had to see my family go through something like this. This was Alyssa, 21-year-old, had the world in front of her, was about to be a mother.
January 9th will always be a sad day for us. I'm just glad I was able to be her mom for a season, and y'all her friends for a season, and sisters for a season.
I'm just glad that this was our place, because I think this was one of her favorite places. I know she's at peace. I know she's being a good mom, So, and that's all she ever really wanted to be.
I don't want this to happen to another family. It's pretty devastating.